Acid reflux or heartburn, also called GERD, is characterized by stomach acid frequently flowing back into the esophagus, which is the tube connecting the throat and the stomach. With the pH between 1 and 3, the strong stomach acid, hydrochloric acid, irritates the lining of the esophagus, causing symptoms of acid reflux and heartburn. There are 3 types of over-the-counter heartburn medicines. Here I'm going to discuss and summarize one type of the medicine, antacids. Antacids are bases used to neutralize the acid inside the stomach. When the acidity of gastric fluid is decreased, symptoms of heartburn caused by acid reflux can be significantly reduced. Antacids work instantly, and the effect of this medication lasts up to 3 hours. Here is a table that lists the common active ingredients in antacids, their chemical formulas, and the chemical reactions by which the antacids neutralize the hydrochloric acid inside the stomach. As you can see, aluminum hydroxide and magnesium hydroxide react with stomach acid without creating the gas carbon dioxide. In contrast, when magnesium carbonate, calcium carbonate, and sodium bicarbonate neutralize hydrochloric acid, carbon dioxide is generated. One of the most common brands of antacids is AlkaSeltzer. Different AlkaSeltzer antacids have different ingredients. Before taking an AlkaSeltzer antacid, it is very important to learn the ingredients and their doses on the back of the container. For example, AlkaSeltzer gums or chews contain calcium carbonate only. If the container is labeled with gas relief, then the medication contains simethicone, which is believed to help disperse the gas inside the stomach and alleviate the symptoms of stomach bloating. AlkaSeltzer gummies contain both calcium and phosphorus. People with severe kidney impairment may need to avoid AlkaSeltzer gummies due to the ingredient of phosphorus. If the bottle of gummies is labeled with sleep support, the medication also contains melatonin, which helps people to fall and stay asleep. Effervescent tablets contain citric acid and sodium bicarbonate. If the medication is labeled with headaches and body aches, they also contain aspirin. I would like to spend a few more minutes to discuss the details of AlkaSeltzer Original Antacid due to its unique ingredients. I also list its generic version, which costs significantly less. The salient feature of AlkaSeltzer Original is that each tablet has, in addition to citric acid, 325 mg aspirin and 1916 mg sodium bicarbonate, which contains 524 mg sodium. When the sodium bicarbonate reacts with hydrochloric acid in the stomach, it generates carbon dioxide, which may aggravate stomach bloating. People ages 12 to 60 can take 2 tablets of AlkaSeltzer Original dissolved in 4 ounces of water every 6 hours. The maximum dose is 8 tablets in a 24-hour period. For people older than 60, the maximum dose is 4 tablets in a 24-hour period. At maximum dose of 8 tablets a day, one will have an intake of 4,200 mg sodium a day from the medication, in addition to other sodium intake from food and beverage. The dietary guidelines for Americans recommends a maximum of sodium intake of 2,300 mg per day. Patients with congestive heart failure should consume less than 2,000 mg sodium a day as recommended by Heart Failure Society of America. Excessive amount of sodium intake increases the risk of elevated blood pressure and aggravates congestive heart failure and hypertension. Because of the large amount of sodium, this type of antacid should be avoided if you have congestive heart failure or uncontrolled high blood pressure. At the maximum dose of AlkaSeltzer Original, one also eats 8 tablets of 325 mg aspirin, which is the equivalent of 32 tablets of baby aspirin a day. This amount of aspirin can increase the risks of bleeding and kidney damage. Because of the increased risk of bleeding from excessive amounts of aspirin, you should avoid aspirin-containing AlkaSeltzer products if you have the following medical conditions: age 60 or older, have a history of stomach ulcers or bleeding problems, currently take blood-thinning medications, take steroid medicines such as prednisone, take NSAIDs such as ibuprofen or naproxen, drink 3 or more alcoholic drinks every day. There are other commonly used antacids in the U.S. market. Tums contain calcium carbonate only. Rolaids has calcium carbonate and magnesium hydroxide in it. Malanta contains calcium carbonate or aluminum hydroxide together with magnesium hydroxide. Both Rolaids and Malanta have simethicone for stomach bloating relief. Similarly, Maalox and Gaviscon contain different bases that help neutralize the acid inside the stomach. Although the antacid medications mentioned here are all brand names, the generic equivalents are equally effective and cost at least 50% less. When taking these antacid medications, you should take precaution not to exceed the recommended dose. Antacid overdose can cause significant side effects. For example, overtaking calcium carbonate can lead to an elevated calcium level, milk alkali syndrome, kidney stones, etc. Some antacids, depending on their ingredients, can also cause aluminum intoxication and elevation of magnesium in patients with kidney impairments. If you have uncontrolled high blood pressure, congestive heart failure, kidney impairment, or are at risk for bleeding, you should consult your physician before taking an antacid medication. If you need to take an antacid at the maximum dose for more than 2 weeks, you should seek medical evaluation to rule out serious medical problems. As mentioned earlier, although antacids provide instant heartburn relief by neutralizing the acid inside the stomach, the effect lasts only about few hours, because this type of medication does not affect the production of the acid by the stomach. If your heartburn problems are not controlled effectively by antacids, you may consider taking histamine 2 blockers or protopump inhibitors for prolonged symptom relief. I will discuss these medications in my next 2 videos.